Welcome to Biztech's Health and Wellness Show, where we focus on equipping you with the knowledge on health and wellness to help you to ensure a more productive and healthy life for yourselves, your families, and your employees. Now, the conversation today is about immediate care for a heart attack. Now, this presenting and content partnership is with Institut Jantung Negara, the National Heart Institute of Malaysia. Now, to bring an expert lens to this topic, we have Dr. Farina Md Salleh, emergency physician at the Institut Jantung Negara, again, the National Heart Institute of Malaysia. Now, Dr. Farina, welcome to the show.
Hi, Brian. Thanks for the invitation.
Now, Dr. Farina, can we start by you giving us a quick introduction about yourself, your training, and your specialty?
Okay, I am a consultant emergency physician here in the National Heart Institute or Institut Jantung Negara. And I've been working here for about 6 years and have been heavily involved in the emergency department processes and with a lot of focus on management of patients with heart attacks.
Now, I want to start with the fact, Dr. Farina, that unfortunately, heart attacks are becoming more and more commonplace and among younger and younger people. Now, could you start by giving us an overview of some of the signs and symptoms of a heart attack?
Well, Brian, thanks that you pointed that out. And, it's unfortunately a sad fact that we're seeing younger and younger patients, yeah? So I've been working for quite a number of years now, and to see someone with a heart attack at the age of 40 was unusual, maybe about 10, 15 years ago. Okay. But nowadays it's fairly common, and we're even seeing patients as young as in their 30s and also in their 20s, unfortunately, having acute heart attacks. So it's very, very important for you to sort of recognize some of the symptoms of heart attack. Now, what is commonly said is that you'll have a symptom of chest pain, and the nature of the pain is could be variable. Yeah? It can be crushing, the severe form, or it can be a sort of a sensation of heaviness. It may radiate to your neck or jaw, and it typically radiates to your left arm. And that is the main symptom. However, there's a lot of variability to those symptoms, and you may have a heart attack even when you're having sort of like a lower sort of chest pain, where people say, oh, I have sort of epigastric sort of pain. I might feel like I'm having gastritis, and this is also fairly common because your heart sort of lies around that area. And if you're having a heart attack that involves the bottom part of your heart, it can also mimic something like a gastric sort of feeling as well.
Okay, so this is a challenge then, because a lot of people then dismiss those early warning signs and then perhaps only are rushed to hospital when they have a more severe symptoms, which is then harder to treat. Am I correct? So could you start by maybe telling us when a person should really seek treatment when they are experiencing a heart attack or some of these symptoms that you just talked about?
Okay, so let's start off with early symptoms. For example, there are telltale signs that you may have blockages in your blood vessels to the heart. So this is the one that causes the heart attack, yeah? So usually you'll have, if you have diabetes and high blood pressure, this causes a bit of damage to your blood vessels in the heart. And okay. There are about 3 major blood vessels in your heart, yeah? And so what usually happens is a gradual narrowing, okay? And when you have this gradual narrowing, some early symptoms that a person might have is symptoms when you are doing activities. For example, okay, I play badminton or I play golf or I usually go for a jog, and suddenly I have a bit of chest discomfort. I think these are early signs, perhaps not of a heart attack, but suggestive that you may have some narrowing in your blood vessels. Okay. Now, some people may have these symptoms before a heart attack, when the blood vessel is fully blocked for some reason, then you'll have what you call a full-on heart attack. And that's when you have typically the severe chest pain, the sweating, the breathing difficulty, the nausea and vomiting. So that's like a full-on heart attack, yeah? And this is when the blood vessel becomes completely blocked, and therefore the muscle, the heart muscle at the end of that blood vessel does not get their oxygen. And this is when you start to have the severe symptoms. And on the other side of the spectrum, if it's very, very severe that your heart stops, it may have affected a large blood vessel, large area that had been affected with the heart attack, then the patient might just collapse. And this is when you need to do CPR. But, you know, there's a spectrum of these symptoms from early signs to a heart attack to the most severe presentation where you might, you know, have a cardiac arrest. So this is the spectrum that I would like to explain to the audience, actually.
Dr. Farina, one of the interesting things that happens, which people are very surprised about, is the fact that, and I've personally encountered people who are very, very fit. A lot of CEOs and senior executives who are fit, they are triathletes, they run, but somehow or other they have a heart attack. They externally don't have the lifestyle or the symptoms of unhealthy living, but yet they have a heart attack. What are the reasons for that?
Okay. I think, okay, so I did explain how a heart attack occurs, which is usually some blockage in your blood vessel and a full-on heart attack when one of those vessels becomes completely blocked, right? Mm-hmm. But of course, there's a spectrum of heart disease. For those that you mentioned, and as you said, it's not uncommon. Very high-performing athletes suddenly collapsing, you know, you see marathoners, cyclists. Nowadays, there's lots of cyclists around, right? Mm-hmm. You know, having sudden heart attacks. So it can be a heart attack, as I mentioned, but it can also mean other heart diseases as well. For example, a very high-performing athlete, right? There's a lot of chronic strain to the heart. The heart is working hard for a long period of time, and this may cause some changes to the heart. The heart might be thick. The heart muscle might be thicker than normal. Because of this prolonged strain, yeah? And this can also suddenly manifest as a cardiac arrest, either a heart attack or where the heart muscle fails, yeah? When you have, you know, in medical terms, we call it cardiomyopathy or thickening of the heart getting bigger than usual because of this chronic stress on it. So this is another spectrum of disease which, you know, is related to the heart, but not necessarily due to a blockage in a blood vessel. Both of them may cause what you call a cardiac arrest or stopping of the heart. So that's another spectrum of disease, actually. It can be either or. Okay. And sometimes, you know, well, as I said, a lot of patients are young, right? Mm-hmm. And when you embark on something like, you know, cycling and marathon, you don't necessarily go for a medical checkup before. You know, not 100% of people go. They might think, okay, I'm young, I do not have any illness, I don't have any symptoms, I'm just going to, you know, train and go for this sporting event. But perhaps that is the time where these things manifest. You know, you have no idea what your heart condition was before. You have not checked whether you've had any other illnesses before. And these things may be insidious as well.
In fact, you have, so this is one of the things where, so I'm an endurance cyclist, so this is exactly what I tell people. Because people say, oh, you know, you're going to ride 400 kilometers and stuff. I said, yes, but I've built up my heart over several years. So I'm able to do this. But if somebody wants to start, I always tell them, please go and get a checkup with the doctor. Just see how it is first. I suppose you have facilities in IJ, and then that somebody can just come in and check up, right?
Yes. So we do have a wellness center. Mm-hmm. It's meant for healthy patients, you know, healthy patients who would like to have their heart checked. There's also specific programs for high performance athletes where you can get the special tests to see your endurance as well. But I think for the you know, normal person who would like to embark on, you know, physical activities a bit more strenuous, as you say, you know, people are cycling 100 kilometers now, you know, people are running marathons. I think it would be wise to have your a cardiac checkup specifically before you embark on these sort of sports, right? And as you said, even though you've built up the endurance, even though it's gradual, your heart sort of modifies, to meet your demands. So that modification can be beneficial, can be detrimental, right? So
Okay.
I think it is very important to actually get a heart check, especially if you're over the age of 30, I think.
Oh, I see. Okay, so I'm well above that. I'm in my 50s. But can I ask, coming back to the question of experiencing heart attack, so
Right.
what is the immediate treatment? What do we do?
Okay, so I would say if you have those symptoms, as I mentioned, chest pain, radiating to the jaw, radiating to the arms, sweating. Sweating is always a bad sign for most things. Yeah, every time we see a patient sweat, we think, okay, this is not right. Sweating is quite a bad sign. Breathing difficulties, nausea, and that sort of gastric feeling. And if I can share with you how difficult it is sometimes. Yeah, looking at our data, and we collect a lot of data here in IJN. The average Malaysian takes about 3 to 4 hours to get to the hospital, not because of whether it's far, it's sort of that decision making, like, okay, there's something wrong with me, from the start of that chest pain to coming to seek treatment is about 3 or 4 hours on average. Why is that? As you mentioned, the symptoms could be on the mild side, and you sort of play it off and say that, maybe nothing's wrong with me, maybe this will go away. And if I can share with you a story, a doctor who was working at an emergency department during the fasting month felt some sort of, as I mentioned earlier, that sort of gastric sort of pain, yeah? And he actually waited in his office for 2 hours. He checked his sugars. He thought he was having low blood sugar. He was sweating a bit, and by the time he decided to actually do an ECG, 2 hours had passed. And he was actually having an acute heart attack, and he was brought to IGN and treatment was given. So again, sometimes this diagnosis is difficult, and sometimes the feeling might be vague. But if you feel that you have any of these symptoms, you're a bit worried, you're sweating, you're not feeling yourself, you're not feeling right, I think the right thing to do is to come to a hospital. A lot of people go to clinics, yeah. Some clinics may have this facility to do this electrocardiogram or ECG. I think we see this a lot in TV. So this is one of the tests, most sensitive tests that we do to look for an acute heart attack.
And you've got a 24-hour
yes.
heart attack center, right? Tell us about that, because that would seem natural. From what I understand, Dr. Farina, the medical fraternity always globally talks about the golden hour. You've got like an hour to get there, and then it helps to minimize the damage. Am I correct? So
yes.
It's coming back from what you said. If you feel discomfort, go straight to a hospital.
Correct.
So we go to say something like your 24-hour heart attack center. Tell us about this.
Okay, sure. So this 24-hour heart attack center does not start just from the emergency department. We actually have a dedicated ambulance. We are working with First Ambulance Services, where in the ambulance there is actually this ECG machine. All right. So if you call for this ambulance will go to where you are, perform the ECG wherever you are. Let's say you're in your home or in your office, and they can actually transmit this ECG to us even before you arrive. So time is heart muscle. This is what we say in patients having heart attack. The earlier you catch the heart attack, the less muscle damage there is, and therefore there's less loss of function in the long term. If you're going to wait very long, there will be damage to the muscle. And of course, once the heart muscle dies, it actually just remodels to become scar tissue. So therefore the function is affected. Okay, so you need to get this heart attack sorted out very quickly. And as you mentioned, golden hour, all over the world, we know that heart attack is the minutes are the golden bits, right? So get yourself very early to the hospital, get an ECG very early. And there are lots of key performance indexes in this, right? Once you come to the hospital, an ECG must be done immediately. As a matter of fact, if you call 999 and you say you have chest pain, you are immediately prioritized to be picked up by an ambulance, okay? And so, in IGN, I'd like to talk about the 24-hour heart attack center. So again, the ECG is done in the ambulance if you call us. Is it all right if I share the number at this point?
Yeah, please do. Go ahead.
Okay, the number is 1-300-885-111, 1-300-885-111, all right? And there you'll be directed to the First Ambulance call center, who will arrange for an ambulance to pick you up, an ECG done wherever you are, transmitted to us in IGN. If it is a heart attack, we actually get our what we call a cath lab, or where we do our procedure to treat the heart attack. We get ready before you come. So once you come, we are ready to send you for this procedure. And this procedure is offered 24 hours, 7 days a week by our many cardiologists in IJN.
Okay, now tell us about the technology that is involved. So this is quite, so a lot of things seem to be done real time, and so there's a lot of moving parts here. Could you tell us about the technology used in your 24-hour heart attack center?
Okay, so typically, as I've mentioned before, we make a diagnosis of a heart attack even before you arrive to IJN. We receive you in the emergency department and make sure that you are stabilized. We might give some tablets that are blood thinners, sort of to start off the process of ensuring that the blood vessel clotting does not progress any further. And then we prepare you to go for this procedure, which is called a primary percutaneous coronary intervention. So it's called, in short, a PCI. Okay. And I think a lot of people have heard about this, an angiogram, basically, yeah? Okay. Where they put a guide wire through your major blood vessel, and it goes directly to the heart, and to the blood vessels of the heart. It looks for the blockage, and then we do an angioplasty, which means a balloon opening of that blood vessel. And this is what you call a very direct treatment of a heart attack. You're going right where the problem is occurring, and you are treating it, opening it, and allowing the blood flow back to the heart muscle again. So that is the treatment. I think it's not something new, but to offer it 24 hours, 7 days a week, I don't think many centers will do that.
Okay, so that's, I suppose, then where you're a little bit different from other hospitals, because you offer this 24 hours a day.
Yes.
And from a technology standpoint, as a patient, is this something that is potentially a complicated procedure, or is it, for a place like IJN, is it a relatively routine procedure?
In IJN, it's a routine procedure. Those who do not have a heart attack, we do angiograms every single day. I would say more than, well, maybe 30, sometimes up to 50 per day. And these are for patients with symptoms, as I mentioned earlier, maybe early symptoms. They're not having a full-on heart attack, and they need to be investigated for the symptoms. And therefore, we do angiograms every day. It's sort of bread and butter here in IJN. We have more than 20 cardiologists who can do it. I think more than any other center. So, and that's why we are able to offer this 24 hours, 7 days a week treatment.
I suppose that is very comforting for me as a patient, because, you know, life is about experience. And if you have experience curve effects, you're doing so many procedures, you become very, very good at it.
Correct. And I'll have you know, actually, besides this PCI or angiogram, there's another method to sort of help with the heart attack, where we give patients an anti-blood clotting sort of something that sort of breaks up the clot that's occurring. So this is more of an indirect method, and of course, because this is more available in government hospitals, it is the alternative. But as I mentioned, it is not a direct method of treating a heart attack, and patients who actually are being treated medically or by medication, eventually they will be referred for an angiogram to see the patency of the blood vessels, to see if there needs to be an angioplasty done at a later date.
Okay, so there is a lot of collaboration between IJN and the public hospital system.
All right. We do have some collaborations as well, that the government hospitals also do refer cases to us, those who have this medical treatment and may have failed treatment. That means the heart attack has not resolved. They also get transferred to us for this angioplasty. And, you know, all over the world, actually, the angioplasty is even more common. In Malaysia, unfortunately, the rate for this treatment in heart attacks is very low. It's less than 20%, whereas in other more advanced countries, this is their bread and butter. This is what they do. They have angiogram centers maybe 10 minutes away from each other, but this is not the case in Malaysia, unfortunately. And fortunately for us in IJN, this is something that we do on a very regular basis. Treatment of heart attacks occurs every single day actually in IJN.
Okay, Dr. Farina, just to recap, key things people need to do, a checklist, key things people need to do in the event of a heart attack, whether it's happening to you or happening to a loved one.
Okay, so number one, don't ignore your symptoms. If you feel something is wrong, you need to get it checked out. My personal advice is to actually get yourself to a hospital as soon as possible. If this is not possible, do call an ambulance. You may call 999 for a government ambulance, or our heart attack center number 1-300-885-111. The ambulance will come to you. An ECG needs to be done. Okay, and once you get to the hospital, this is the preferred treatment. However, I think one important thing to actually put out there is for everyone to learn CPR. I think this is really important. CPR saves lives. Again, the earlier you give CPR, the better. For your information, IJN is also accredited American Heart Association Training Center for basic life support, and we also train not just doctors, not just doctors, nurses, medical personnel, but also the general public. If they would like to get in touch, we do have a CPR faculty. We also teach infant and child CPR, which also coincidentally we also teach on choking. So these are very, very useful things to learn, I think, not just for the heart attack, but also in general. And as I mentioned before, the worst scenario of a heart attack is a cardiac arrest, and you need to know what to do when that happens before the ambulance arrives.
Okay, and that's interesting. So, and I got CPR trained about, I think 30 years ago. So I really need to update. But I think one of the usefulness that I see in terms of CPR training is really for companies and corporates to have somebody in-house or some of their staff that are actually trained in CPR. So I suppose they can reach out to you and to IJN and get themselves certified.
Yes, that's right. So the guidelines are updated internationally every 5 years. Every 5 years, it doesn't change drastically, but it's all evidence-based. They look at all the studies around the world, and they sort of make it simpler, a bit more standardized, and they tell you what works, what doesn't work. And basically, the very simple things is chest compression and doing the right technique. Nowadays, for lay rescuers, they don't encourage mouth-to-mouth, obviously.
Yes. So you put a tube or something and then you blow, is that how you do it?
There's an equipment that you can use. However, if you have any doubts, chest compression only CPR also works. I've actually personally done this in a public setting, and it works, So at the very least, learn how to do chest compressions correctly, and this actually saves lives.
Now, what can people do in order to reduce the risk of heart attack?
Okay, so I think we've seen a lot of this in the media about obesity in Malaysians, right? And sadly, we are a food haven. We have really good food, whether you're Malay, Indian, or Chinese. We all love our nasi lemak. We all love our roti canai. We all love our teh tarik. And things should be done in moderation. Maybe nasi lemak once a week. But yeah, so I think diet plays a very important role. A lot of us find out we have high cholesterol, even at a young age, and even as you grow older, sometimes in your 40s, even if you control your diet, metabolically, your system may not be, as young as it used to be. You may just have high cholesterol, even if you control your diet, and you may need medication. So diet is one thing. The other one is physical activity. It doesn't have to be 100 kilometers of cycling. It doesn't have to be 20 kilometers of running, sort of moderate exercises to, build up your stamina, to strengthen your heart, maybe 2 to 3 times a week. So diet, exercise, and just general healthy living. And the number one crime, I think, for heart attacks and heart diseases is smoking. It's smoking.
Okay.
It's smoking. So as I mentioned before, all those young people who have heart attacks, I would say the majority of them started smoking very young and very heavy smoking.
Okay, and so that's really something that we all need to keep in mind, because not only are the smokers affected, it's their loved ones through passive smoking.
Yeah, you're talking about someone in their 30s having a heart attack and then having poor heart function, from age 30 until age whatever they live up to, right? Whether it's 60 or 70, and you have young children, and you become someone who's non-productive, someone who stays at home, someone who cannot earn income. So this is a general burden to the nation, actually. And smoking is something you can do without. I mean, it's not, I hope, I've never tried smoking, but I think, it's one of the most unnecessary habits that someone can take.
Dr. Farina, it's been a fascinating conversation. I learned a lot, but are there any final thoughts you would like to leave us with before we end the show?
I think in general, I think there's a movement to live healthily. It's good to join that movement. At the same time, even if you do not have symptoms, go for a regular checkup. Have a baseline, know what you know about your own self and your own health. I think that's very useful. You don't want to detect things late. You want to detect things early. You may have a tendency for things like high blood pressure and diabetes because of your family and genetics. And it'd be very useful to know these things at an early age. Remember, in Malaysians, happens early. In other advanced countries, you get heart attacks in your 60s. In Malaysia, it's 30s and 40s now. And we just need to break that cycle. I think it's just so unnecessary.
Absolutely. I completely agree with you. Dr. Farina, thank you very much for taking your time to be on the show.
Welcome. Thanks again, Brian.
Now, I'm Brian Fernandez, and I've been speaking to Dr. Farina Md Salleh, emergency physician at the Institut Jantung Negara, the National Heart Institute of Malaysia, on Biztech's Health and Wellness show, presented by Institut Jantung Negara. This video will be on our various social media platforms, as well as our website, www.biztech.asia. Please like and subscribe to our various platforms. Thank you very much for tuning in.